is PHI, or as you know it, Public Health Insider. I am your host, Jade Brown, and with me today, it is my esteemed honor to introduce to you Dr. Kester Nedd, CEO of the JIPA Network. Welcome to the program, Dr. Nedd.
Thank you.
All right, great. It's so good to have you back here. Of course, working so closely with universal health coverage. And we thought it very important for you to come on and really speak to the masses about the JIPA network and your affiliation with universal health coverage. So let's get right into it. We only have half an hour and we have so many questions we want to get through. How does JIPA align its support with St. Lucia's national goal of achieving universal health coverage?
So, JIPA Network was started in 2012 in the US, of course, but with the input and participation of Caribbean physicians and the Caribbean healthcare system. I'm originally from Grenada, but had my education in the US as a physician, having been involved in the technology associated with healthcare and the building and development of healthcare systems. So our mission and our goals actually intertwined well with St. Lucia's goals for universal healthcare, and that is to make healthcare available, accessible, and affordable. We call that the three A's to all citizens. And in fact, from a World Bank perspective and a World Health Organization, the whole mission of universal healthcare is to make healthcare funding, healthcare services available in a manner that it does not cause poverty in a country. Uh, One of the challenges we have in developing nations like St. Lucia, Eastern Caribbean in particular, is that the systems that we have in place is not set up in a way that allows us to advance healthcare services to where we would have a sustainable and efficient way of delivering healthcare services to all citizens. And that comes because of our colonial history in how we manage our healthcare system, and partly because the healthcare system is fragmented, it's not consolidated. And for healthcare to really work, and for any type of business environment in healthcare to work efficiently, we must have everyone come together in a way that we achieve something called economies of scale.
Right.
So the larger you are, is the lower the cost, the more efficient things get, and the more services you're able to deliver. Uh, so, for example, if you take a heart surgeon, right? A heart surgeon requires a population of almost 200,000 people to receive enough cases to keep that heart surgeon busy.
Okay.
So we start off with only 184,000 people. So we may not have enough people to support a heart surgeon, but we could make it happen by having visitors from other countries participate. But if you only have a small population, only the insured population, which is only 12.2% of the population receiving care from the heart surgeon, that's not enough population to be able to allow that heart surgeon to remain in the country.
Now, I think that that draws me to ask my second question, and I think you touched on it when I asked, what are your impressions of the current health financing landscape in St. Lucia, and are there foundational strengths or critical gaps that stand out?
So the first one that stands out is the one I already alluded to, and that is the fragmentation of the healthcare delivery system. So even though you have very qualified physicians, because the system is so fragmented, we're not able to build what we call centers of excellence.
Right.
So I'm a neurologist and I treat people with stroke. I treat people with neurological diseases. For me to function, I need a team. I need a team of nurses, technicians, therapists. I need certain medications. And unless I have a coordinated care delivery system, and if I don't have it here, I need to have consultants abroad that I could work with. So what we need is a dynamic system that allows for a sustainable, efficient way of delivering very high quality healthcare
How
to
do
a
we balance
population.
that?
The challenge is that we are small nations. We are separated by language, by culture, by water, by many things. And we've been talking about federation in the Caribbean for many years. Well, there are some industries that have been successful in bringing this together. One of them is the banking industry. Okay, and the banking industry been able to create one national standard, international standard for the Eastern Caribbean. Therefore, we have a stable currency and we have a trusted banking system. We need a similar system in this region. Again, the challenge is how do we get all of the Caribbean states or the Eastern Caribbean states to come together to create that mass so you achieve the economies of scale. We got to start somewhere. St. Lucia is in the best place of any Eastern Caribbean country to start the process up.
Now, given that, what kind of mechanisms can we put in place here in St. Lucia to help St. Lucia move away from that out of pocket cost when it comes to healthcare?
So out of pocket cost comes again because of fragmentation. What we say, each person to their own. If you have an insurance company with only 100 people paying premiums, you can't afford to do a bone marrow transplant. The government can't afford to pay for it, and you can, because you don't have enough persons contributing into that system. But if you have 184,000 people, which is the population of St. Lucia, contributing small amounts through the government, through the insurance company, and through whatever mechanism, the NIC and others, you could afford not just one bone marrow transplant, but many. A bone marrow transplant could cost upwards of 250,000 to 600,000. That's a life-saving procedure that in today's world could save your life if you have certain types of cancer. But if you go as a small nation only with a small amount of people, you will end up having to pay most of this out of pocket. So the model that we're presenting to St. Lucia to make it possible for people to have great primary care, great secondary care, and great tertiary care. Tertiary care means the most advanced services that's required where you have high cost catastrophic events, right? We have to consolidate and share across the board. That's a critical part of what must happen in healthcare financing in St. Lucia to make this happen.
I understand. So, I would like to ask you, what are your thoughts on coming into St. Lucia and with your level of expertise um, in healthcare and in healthcare financing? When you came across St. Lucia's model for UHC, what were your thoughts on it?
So first, when you look at the current system, first I will, we've been doing this in many Caribbean islands, looking at their healthcare system, looking at how they approached uh, universal healthcare. In other countries, they call it national health insurance. We looked up the large countries, the small countries, and so forth. So there are some positives in St. Lucia. I want to point those out first. First, you have a very committed and dedicated group of professionals that are building this. I'm so impressed compared to other Caribbean nations in terms of how motivated people are. Second, we've been out speaking with businesses, with the public, and we see a level of enthusiasm that we have not seen anywhere else in the Caribbean to make this happen. And certainly, there is enough political will to make this happen on all sides. So, those factors, considering, come together to make the planets, in other words, have lined up. In addition, the economic situation of St. Lucia at this moment in time is the best time St. Lucia would potentially has ever had from looking at the past to now, or potentially will ever have to be able to invest in healthcare. You're at a great time in your history in terms of your economic growth. So this is all of those things are necessary. The professionals in healthcare are also ready to make the move towards a better healthcare system. So that's on that side. On the side of what challenges we see is that technology uh, is badly needed that connects all elements of the healthcare delivery system in order to use data to help us make proper decisions. So even though we come up with a great system of healthcare for St. Lucia, a great system of paying for healthcare, if we are not in a position to track events as they occur, as this would not be sustainable. So one of the first investments that the country must do is to invest in its information technology infrastructure, both for patient information and to look and follow all of the financial services and the costs and the availability of resources, how they utilize to make the system more efficient.
Now, with St. Lucia, we are, of course, a small island developing state. And while I agree with your point in terms of um, the state of our economies presently, one could say that there are mitigating circumstances that could throw us off course, like natural disasters, for example. We have this impending hurricane season. How can we protect against economic shocks?
First of all, your model, the model you create is really important. And I guess we might talk about this in a minute. That's one first. So if you have a model that's sustainable, it will have built-in protections. In many countries, and in fact, insurance is a mechanism that's often used to mitigate shocks. That's why it's called insurance. So when something disastrous happens, you're prepared and you have a fund that's there to pretty much ensure that your systems don't go kaput. Now, in many countries, people have put aside, or governments, and put aside resources to do this. I'll give you an example. In the United States, in the state of Michigan, they have a system that they've adopted under what they call no fault insurance. So someone gets into an accident, all right, and normally you have to go to your insurance, get paid for the services, and so forth. So rather than you having to go to the insurance company and fight with them for the dollars that you need, the state created a small fund where a small percentage of every dollar that you pay for insurance goes into a fund. So when you have a catastrophic illness or catastrophic condition that's way beyond what the insurance is going to pay, or way beyond people's own budget to pay, they could pull from that fund and support this. Now, what that does, it preserves the institutions that already exist so they don't run out of resources. It preserves the healthcare or the delivery system so they don't have to give excessive amount of care without compensation. Because now you have a reserve fund. This is an example of ways that a country as small as St. Lucia could invest in long-term planning to ensure that you have a sustainable healthcare delivery system. There are many, many examples around the world that we could utilize in this model here in St. Lucia to be able to achieve sustainability. So it's not here today, gone tomorrow. Of course, you have to pass legislation that allows for the sustainability so that as things changes, as government changes, as people change in terms of the leadership, that sustainability effect remains in place. And that's a critical factor in keeping the system of financing sustainable.
Most definitely, and I think particularly now in our time in St. Lucia, people would have concerns about it. And I know that at our various sensitization drives, people have asked that question. So, how exactly would you go about? Tell us a bit more about the model, and tell us how we would mitigate against something like that occurring.
So, like we started talking about the whole idea of consolidating healthcare to achieve what we call economies of scale. Economies of scales mean as you bring together, cost gets less, the system gets more efficient, and people are able to perform their services in a way that it's it's truly helpful and efficient. Consumers realize the benefit. So the model we've we've built or we've put together and we've developed policies around that model for St. Lucia is a model that we call SPARK. It's called Stratified Pooled Risk Coverage. So the word pooled means that you take the doctors and the hospitals and every entity and you bring them together as one unit. You take the funding sources, you bring them together as one unit, and you bring the population together as one unit. Rather than saying, okay, these are the people with insurance, they're in one bucket. These are the people without insurance that the government primarily supports. These are the people that through NIC because they have an accident. And what you do is you spread the cost across the entire population. That's called population health. This is one dimension of healthcare financing. Once you achieve population health, you are able to achieve economies of scale. So that's the first move, is to the population dynamics. You put population together. The second part of this is you look at the global cost of healthcare financing by identifying all sources of payment and all sources that you need to pay for. And you bundle that together, and based on World Bank suggestions, 5% of GDP, about 5.2% of GDP, most countries in our state should use to that. Well, St. Lucia is almost there. Our problem is that the funding mechanism is so segregated, we don't know where the money is going. We can't see how it's spent. We can't measure the efficiency, and it's distributed in a manner that everyone doesn't benefit. So on the financing side, instead of segregating each financing entity, what we've done is stratify them. That's why we call it stratified pooled risk. So we pool first and we stratify after. So in the model, the first strata is the government responsibility. So all citizens, rich, poor, would have access to that money because we pay taxes for that. Okay, and the government has already invested 190 million in the Ministry of Health. And of that, about 65% goes to absolute care, which comes out to about 114 million. Consumers currently contribute 37 cents on every dollar in healthcare. That's $108 million in your economy. That's a lot of money for consumers to contribute out of pocket. And it's a major reason for the public to experience financial hardship. So the whole idea is by taking all of those and spreading that cost across the entire country, it comes to be a small amount that everyone has to pay. That solves that problem. So that if you have cancer, you have a major diagnosis where something costs $50,000, the entire country helps pay for it. So rather than you having to go sell your car, your kid is ready to go to college and you can't pay the tuition, so now you have to take care of an illness or you have to go out and do a cookout to raise funds, you would have enough reserve dollars into that fund once it's set up properly to be able to afford so that all persons could get proper health care.
Okay, that's what
The
I
second tier involves the commercial because we want them to participate. One of the challenges you have, St. Lucia has a large what's called informal economy. What that means is there are a lot of people in the society, particularly in the professional category, that could afford to pay for health insurance and don't. There are a lot of those people who could pay a little bit more in taxes to support the country and don't. What you have here is a wage support of the society. So, for example, you pay to the NIS or NIC, and mostly middle class to persons who have lower income are paying into that fund. But the people that come into that informal economy aren't paying as much. But what we want to do is to get those people to fund healthcare by buying health insurance. The more they purchase health insurance, is the more dollars that come into the system. Well, some of you out there might say, why are we buying insurance when they're not treating us right? That's always we hear from others out in the community. Well, insurance is a business. But if we set up policies and a good structure that allows the insurance industry to thrive in our marketplace, our system will be better. When you look at all the Caribbean nations who have implemented universal health care, fundamentally, they've excluded the insurance industry. And that in itself has put a lot more burden on the government and the taxpayers to be able to support. So the system that we're creating here in St. Lucia would allow us more people to participate. When you think of this country, your per capita income is about $1,500 per person per month. And only 12.2% of the population have health coverage. And a country like Colombia, where the per capita income is like $700, which is way less than St. Lucia, all right? They have 98% of their population with coverage. So what that says, there is a way to do it where everyone could get healthcare coverage. We just have to be willing to take the steps necessary to do that.
Now, with you going on the ground with the various sensitization drives going throughout the various communities along with the UHC team, um, do the people, what is their level of understanding of JIPA and their level of understanding of health financing? Do you find that the information is being consumed in the right way? Are they on board with it? How are our people responding to universal health coverage and universal health financing?
The questions that people are asking us is, how fast could we do it? Uh, what would it help us with? For example, one of the things we hear from the public is, we have insurance. We get sick, we go to the doctor. We have to take money from our pockets and pay. And then we have to go to the insurance company and get reimbursed. Well, what they say to us, many persons don't have the actual money to pay up front. So they avoid going to access care. Just that simple challenge that people are faced with, if we could change that under universal health care, more people will buy insurance, more people will access primary health care early, so they don't have to wait until the disease or the condition gets so bad that the cost goes up. So this is what we call this is care coordination. The ability to coordinate people's care in a manner that allows them, one, to seek care early, do preventative care at a primary care level, and certainly there's an initiative going on in UHC now, funding from the World Bank, on hypertension, on diabetes, on snake bites, on cancer, on all of those issues. Very successful. The people in the community are quite responsive to it. And this is sort of a preamble to how UHC will work once it's financed in its totality. So since 2022, that process has been going on in St. Lucia, and it set the stage now for implementation of the broader universal healthcare financing. And I think that's one of the reasons I could safely say that St. Lucia is in the best place, because you've done the groundwork. Think about what's going on. At the same time that you address the population health issue, you're also addressing the facilities. You have St. Jude's coming on board. You have lots of changes occurring in the public health clinics at this point in time. And so when you match that with what has already been done through some of the population health exercises through the World Bank, and you bring in now healthcare financing, you are in a powerful position as a nation to fully implement universal healthcare. And within a short period of time, because a lot of that groundwork, and there were work prior to even this current administration, work was been done in the past to get this to this point. Right. So that's one of the reasons when I started, I'm saying St. Lucia is in the best place to be able to implement universal health care.
Excellent. Now we are in our final 3 minutes. Is there anything else, or before we go into that, what key lessons have you learned from other countries pursuing UHC that could be relevant for St. Lucia? And I think lastly, how would you, I wanted to ask about the insurance companies and how they have received UHC's um, route for health financing. So maybe you can touch on that also. And also add in there, Dr. Ned, anything else that you would like the public to know about JIPA, about UHC health financing here in St. Lucia?
Okay, so the first question would be, you want me to answer the insurance first? So the
Yes.
insurance companies we've presented to, they understand that this is a seismic shift from the way they do business. But they see opportunities because if more people become insured, their policies would be healthier in terms of the premiums collected and so forth. The seismic shift is from moving from a reimbursement system to a payment system, where you as a consumer now are not going to get reimbursed. But through the UHC authority that we plan to set up, which would be an independent body of the government that would run the universal health care, they would be the one making the payment to the insurance company, not the consumer. That's a seismic shift for insurance. But it gives them the security, it gives them the confidence, it cuts the administrative costs so they don't have to deal with all that paper. By reducing that alone, it'll impact on their ability to insure more people, reduce the premium costs and so forth, and offer more services. So they see it as an opportunity. Now, insurance companies are very conservative in the way they do things. So change is not in the vernacular. But based on um, our early conversation with them, we see tremendous movement towards this. And there are those who would love to have exclusivity in this matter, but we feel that there are very strong insurance companies in the marketplace. The regulations that govern them are in place. And when you add UHC to this, it'll help a lot. Now, so the next point you ask is about JIPA. Uh, One of the reasons why JIPA was chosen to do this is because, one, I'm from the Caribbean and I have a good understanding of the Caribbean healthcare delivery system. My work has been in the University of Miami and Jackson Health Systems, where I served as the international uh, medical director for Jackson Memorial Health System. So I had the opportunity over 15 or more years to travel throughout the Caribbean and Latin America and get a good understanding of what healthcare providers and consumers are facing. What we did in JIPA is to build a public private partnership that works, where we able to take people who need healthcare that cannot be provided in their country and find places and ways to get them healthcare that they need. We, in this period from since 2012, have serviced over 7,000 clients. And the experience from doing that has taught us a couple of things, that whether you're rich, whether you're poor, if you could bring private public entities together and you could consolidate healthcare, you are able to get good access and at its lowest cost. So this is a model that we know works. So we're saying to the governments of the Caribbean, if we could do the same type of consolidation when we purchase medications, when we buy services that we need on a consolidated basis, we're going to ultimately lower healthcare costs for everyone and make it more accessible. So this model has worked for us, and it's worked for the people that have used it, from governments, from private companies, from private individuals who have used it. And we're saying if such a network of healthcare providers between Latin America, the Caribbean, and the USA has been successful in gaining access to people, why not implement this in our region?
Thank you so much, Dr. Ned. Just quickly on our Facebook page, um, we have a few comments I cannot read out. But it's not negative towards us. We're in that season right now, so I can't read those comments. But we do have some people saying greetings, very informative and whatnot. So thank you everybody who joined us on the Facebook page. Do remember that we are here every week, every Wednesday from 9:30 to 10 a.m. Next week we will be discussing the St. Jude Hospital reconstruction project with yours truly and my guest. We'll be announcing that guest. Please look out on our pages for that information. Also, please do tune in again next week. Dr. Ned, thank you for coming on. I do hope that this is not the first and the last time. We hope to see you many more times again on the
Thank you.
show. All
Thank you.
right, thanks a lot. This has been PHI. Have a good day.